Welcome to Stand Up for Doctors. I'm your host, Kim Downey. Thank you very much for joining us. This channel is dedicated to amplifying the voices of doctors, other healthcare professionals, and patients as they share their unique struggles, triumphs, and passions. My mission is to build connection and create advocacy for healthy doctors, driving positive change that benefits both doctors and patients. This is a space for everyone who cares about the future of healthcare. If you appreciate this content, please like and subscribe now. It really helps the episodes reach our target audience. And I would like to welcome Corey Feist and Dr. Stefanie Simmons. Thank you for joining us today, Corey and Steph.
Thanks, Kim. We're excited to be here.
Thanks, Kim.
You're welcome, and I'm excited to have you. And by way of a very brief introduction, because I would like you to introduce yourselves, Corey Feist is the Chief Executive Officer for the Dr. Lorna Breen Heroes Foundation, and Dr. Stefanie Simmons is the Chief Medical Officer for the Dr. Lorna Breen Heroes Foundation. And today we'll be talking about how May is Mental Health Awareness Month, and you'll educate our audience about the work of the Dr. Lorna Breen Heroes Foundation, and I'm very proud to be an ambassador. And also, I would like to know about the 6 actions of the new campaign, Health Workers Have the Right To. And as we begin, and I ask you what you would most like our audience to know about you, Stefanie, would you like to go first?
Sure. Thank you, Kim. So my name is Stefanie Simmons. I'm an emergency medicine physician by training, and really throughout my career have led work in professional well-being and patient. I was doing that work for a large national medical group at the beginning of the pandemic and was introduced to Corey and his wife, Jen, when they started their foundation, and have been thrilled to serve the foundation first as a board member and then as the chief medical officer for the last 2 years.
Yeah, well, thank you so much for your work in this very important mission. Corey, what would you like our audience to know about you?
I'm not a healthcare physician, nurse, pharmacist, physical therapist, occupational therapist. I am a healthcare leader. I started as a healthcare attorney. Don't hold that against me, audience, but I was always looking out for the well-being of the clinicians, particularly when it came to their day-to-day operations as the chief executive officer of the University of Virginia Physicians Group, as well as a variety of other roles I had at the University of Virginia Health System before starting the Dr. Lorna Breen Heroes Foundation in 2020. And I'm really excited to be having this conversation with you and my partner, Dr. Stefanie Simmons, who is absolutely the best chief medical officer in the country.
That's
I have to say that in our contract. I have to say that every podcast I do.
Yeah.
That's fantastic. So our audience is primarily physicians, but not only physicians, and
Yeah.
not everyone is familiar with the background of the Dr. Lorna Breen Heroes Foundation. Corey, would you like to share a bit about that?
Sure. Our namesake, Dr. Lorna Breen, was an emergency medicine leader and physician in New York City. She took her life April 26, 2020, following a very, very short mental health episode, which followed her being very sick with COVID-19 and then returning way too soon to the clinical environment, feeling like she was obligated to do that because of the culture in medicine and her leadership responsibilities, but she was really incapable of performing. But then once she was back into the emergency department, did not feel like she could step away. Otherwise, it would be a sign of weakness to her colleagues. And Lorna, unfortunately, tried to push her body and her mind through, but was unable to keep up after about 5 or 6 days, finding herself catatonic in her apartment, really needing immediate emergent mental health treatment. We obtained that treatment for her down in Charlottesville, Virginia, where our family is. And shortly thereafter, Lorna began to express to us concerns that by now obtaining mental health treatment, she was going to lose her license in New York State as a physician and her hospital credentials at New York Presbyterian and Columbia Medical Center. And so, unfortunately, she made a decision, which is an irreversible decision, to take her life. After that tragic decision and that tragic occurrence, our family then found ourselves in national news trying to respond to media attention that we did not ask for or want. But that media attention actually drove a tremendous amount of feedback from clinicians, their family members, and friends, all sharing similar concerns around the mental health and well-being of healthcare workers. And so based on really the feedback that we heard from thousands and thousands of healthcare professionals, their families and friends, we created the Lorna Breen Foundation in the summer of 2020 with the focus on reducing the burnout of healthcare professionals, safeguarding their professional well-being and job satisfaction. We envision a world where seeking mental health care is a sign of strength for our healthcare workforce. And so we've been at this now almost 5 full years, following, and I should say not following, but during that time really have made a tremendous impact on this topic of professional well-being and the mental health of our health workers. And we've got a lot more to do, which is why we're really thrilled to be with you today, Kim.
Yeah, well, thank you very much for sharing all of that. And you certainly have made quite a tremendous impact in a relatively short period of time. And as you know, I'm doing this work because one of my amazing doctors, took his own life, and I felt the calling to support doctors. So I love that we're all working together to make a difference. Stephanie, would you like to share how you became involved in the Dr. Lorna Breen Heroes Foundation?
Sure. So in 2020, I was running the professional well-being work for a 26,000 physician medical group across the country. And one of the parts of the professional well-being work that we had was a team of coaches, 15 physician coaches, physician leaders who went through coach training and were there to support their peers. And one of my coaches, who's also a regional medical director, was getting his MBA at Darden School of Business, where this new nonprofit leader, Corey Feist, was giving a case about professional well-being. And so my coach called me up and said, "You should really connect with this guy. He talks about this stuff the way you talk about this stuff." And so, I called Corey on LinkedIn, and like email messaged him and said, "Hey, I'd love to connect. This is the work that I do, and any way I can be of service, I'd like to be." So very generous with his time. Corey and I think talked for about 2 hours that first time, just about what he and Jen were trying to do, and what they were hoping to do. I shared my work. And at that point, we just left it as, well, I hope there's some opportunity to work together in the future. And that didn't take too long for that opportunity to arise, and the rest is history. But I think it's important to mention, the genesis of the foundation and Lorna's story is certainly tied intimately to the COVID pandemic. But the problem of healthcare worker burnout, and mental health conditions, it didn't start with the pandemic. This has been a problem for decades, if not longer, and was actually recognized and referred to as an epidemic in healthcare at the National Academy of Medicine report in October 2019. So there, those of us who had been working in this area have felt for a long time like we were knocking on a heavy oak door going, "Hey, there's a problem out here, everyone." And then during the pandemic, that door sort of cracked open a little bit, and people poked their heads out and said, "Is everybody okay out here?" And the answer resoundingly was no. We're not, and things certainly got worse during the pandemic, and we are still, as a profession of medicine, but also in healthcare writ large, recovering from that experience to what was admittedly a pretty lousy baseline. And so while we're starting to return to that baseline, we're not there yet, but we're starting to return to that baseline wasn't good. It wasn't functional, and the work continues.
Mhm. Right. Yeah, 100% to all of that. And I hadn't heard your connection story before between the two of you, so I loved hearing that. And it's so true. And just since I've been involved in this work for a couple years, I feel like more doctors were suffering, even more doctors were suffering in silence before the pandemic, and that the pandemic, in a sense, did break things open. And I love it that on LinkedIn, that more doctors are talking about these things. And I say on so many of these episodes that every time a doctor shares their story, another doctor feels less alone. and we'll be publishing this in early June. And that's actually around the release date of my first in a series of Stand Up for Doctors books. So it'll be based on these YouTube episodes. So one day, if you want, you could actually be in one of my books. And the title is we just decided yesterday, it's White Coats, Courageous Hearts, True Stories of Doctors Reclaiming Their Humanity in a System that Challenges It. And we just have all these real stories that we're sharing. And Corey, what would you like to say? And if you want to get into the actions of the new campaign.
Yeah, Kim, and it's a perfect segue. It's all, what we've learned about one way to make a really big impact is through storytelling, and hitting people with both the head and the heart, if you will, in conversations. I know in healthcare we speak so much in data, but it's really those stories that move people to action. Certainly, Lorna's story was one, but we have really many, many more. We've heard from the families of so many physicians and nurses and others who have unfortunately lost a family member to suicide. And there are so many commonalities between the stories. So, to that end, Steph actually spent a year working with our national coalition, which we call All In Wellbeing First for Healthcare, which we created, by the way, in 2021 with over 30 of the largest healthcare associations in the country. Steph spent about a year working with that group to really further identify what are the concrete barriers that stand between clinicians and getting mental health treatment. And so we've developed, and under that same thought, all in, we've developed All In for Mental Health, which can be found at allinformentalhealth.org. And this campaign, as you alluded to, is really founded on the premise that patients have the right to access mental health care and support. Healthcare workers have that right too. It's in some ways that simple a concept. In order to take action, though, to demonstrate that organizations are all in for mental health, we have 6 concrete actions for those organizations, as well as policymakers and others, to take. The first is to provide accessible and affordable mental health care. We have heard that, particularly during the times of the day that clinicians need that mental health care, it's not always available. For some, they are so concerned about the confidentiality that they need to pay in cash or want to pay in cash. And so this needs to be both accessible and affordable. And as Steph also likes to say, it needs to be delivered by a real subject matter expert who's well versed in the day-to-day experience of clinicians. The second is confidential professional or physician health program support. We work very closely with the Federation of State Physician Health Programs, and almost all states have a physician health program. Some states actually combine that with other healthcare professions. But we want to make sure that individuals understand that they can use these services not just for substance use or being mandated, which in many cases people think about it in that context, but being mandated by a board of medicine, but rather for voluntary treatment that they can obtain. And we want to make sure that the standards that those physician health programs adopt meet the high standards of the Federation of State Physician Health Programs. And there's some variability there. So we want to make sure that everybody is kind of achieving that same standard. The third is equal privacy in mental health care. This was Lorna's biggest concern, that obtaining mental health care would compromise her professional career, her credentials, her license. Over the last few years, as a very focused effort in that way, we have developed a campaign called the All In's Champions Challenge, which provides individuals, organizations, licensing boards, concrete steps on how to remove overly invasive and, frankly, inappropriate and illegal questions from credentialing applications and licensing board applications, which ask inappropriately about the prior mental health treatment and diagnosis of the applicant. We know from all of the data that these questions serve as one of 3 drivers of suicide among health workers. And we continue to hear from healthcare professionals across the country, both nurses, nurse practitioners, physicians, and physicians' assistants, how much a barrier these serve. And so we need to not just remove those barriers, but overly communicate, I would say, the new set of rules to the workforce. The fourth is confidential peer support. And if there's one thing we continue to hear from the workforce is that they want to talk to somebody, even if they don't have a mental health condition. They want to talk to somebody who has walked a day in their shoes. Well, when they have that conversation, it needs to be formally confidential, if you will. In other words, it needs to be free from the ability for a plaintiff's attorney to seek that the documentation supporting the peer support encounters in a subpoena during a lawsuit. And so we want to make sure that it is truly confidential, just like other types of quality improvement conversations or investigations. The fifth is education and training on mental health and professional well-being. Again, as a non-physician and a non-clinician, I frankly assumed that there was more training in not just medical school or nursing school, but also as clinicians go on in their career about real mental health conditions, about suicide prevention. What we've seen is when you bring that education and training to bear, healthcare professionals, are more open to having conversations. They know how to have conversations with their peers when they see their peers exhibiting symptoms that need to be treated or immediately and urgently addressed. And so making sure that there is broad-based education and training and that it begins in medical school, nursing school, and other health professional school, and then continues through their career. And then finally, a supportive pathway for reentry is the final step of the final action. We've heard from so many clinicians that when they go, if they have to take time away from clinical care, that when they return to clinical care, it can be like they're getting a lot of the stick and not a lot of the carrot, if you will. And they're very heavily penalized for that. And so we need to make sure that there is a supportive pathway for them to reenter. Candidly, I think that was one of the biggest concerns that Lorna had, which was, I'm going to lose my license, I'm going to lose my credentials, but I can never return to my clinical environment without having a scarlet letter on my chest. So that's the last one. Again, there's more information that can be found at allinformentalhealth.org, and I really appreciate you giving me the space to share that, particularly for Mental Health Awareness Month in May, but also as this campaign grows and matures. And the final thing I will say about it is we're looking for stories from clinicians to share about each one of those different actions. And so if your listeners have a story, please contact me. My email is Corey, Corey, at drbreenheroes.org. Maybe you can put that in the show notes for us. But please send us your stories and your willingness to share a story, because we want to also elevate those lived experiences, just like as we have continued to elevate Lorna and others' experiences. So thanks, Kim.
Well, thank you. And I love that. And that was an excellent summary. And when you hear all those things, it comes to mind that it should already be like that, right? So all of this work that you have to do that we shouldn't have to do because it should already be like that. And as a physical therapist, on the back of my license, I only have to say things like, the answer to the question of like if I was convicted of a felony in the last year, like things like that. And so just thank you. You just described it so well. So Stefanie, anything you would like to speak about any of those in particular? And if you'd like to, especially about the PHPs, I've actually had a couple episodes about those, and a couple doctors spoke that they had negative, experiences or heard of so many really catastrophic experiences. But then I had on another physician, and I know of another one who have used them a couple of times and would praise them.
Mm-hmm. Well, I'd love to go back to how these actions were determined. And, originally we were thinking about what are the sort of rights to mental health access that healthcare workers have. And I mean, we actually started much broader, right? Which is like globally what is needed for healthcare workers to be more mentally healthy. And that can really be the world, Kim, right? Because there's all sorts of workplace risks that healthcare workers face that predispose us even greater than the general population of humans, right? And for every healthcare worker is also a human. And so what we did is we narrowed it down first to mental health access for healthcare workers. And so recognizing that there is a healthcare milieu that impacts the healthcare workforce, focusing in specifically on mental health access. So our goal here was to think first, how do we think about the stories, the heart, right, behind these actions? Second, what is the evidence? What do we see out there as best practices? So what's the logical argument or the head? And then what's the path forward? What are the actions that can be taken that will make a substantial difference? So all 6 of these actions were really that heart, head, path forward, which is what you need to be able to affect change. So specifically on the physician health programs, I think it is important to think back to what it is like when there is not a professional or physician health program, which is that when a healthcare worker or a physician becomes impaired, right? And that could be impairment because of substance use disorder. It could be impairment because of a mental health condition, or frankly, it could also be impairment because of a physical health condition. Before physician health or clinician health programs, or in those limited states where they do not exist, that became immediately a disciplinary board action. And the restrictions on practice and on licensing were handled strictly through the board, and they did not include treatment. They included board licensing restriction and were also public with a public name and shame component to the action. So if you became impaired for any reason, you would have discipline through your licensing board. You would be publicly named, and there was no treatment or remediation of the impairment. So that's what the world looked like before the professional health programs. Now, an ideal professional health program serves as an alternative to discipline by the board and offers a comprehensive treatment program and a return to practice. So when a clinician becomes impaired, they ideally voluntarily self-report to a PHP to enter treatment. What actually happens is they are often reported, just as they would have been previously reported to the board, they are reported to the PHP, and their treatment program and certification to be safe to return to practice serves as an alternative to that public disciplinary process that existed previously. Ideally, that care is paid for either by the state because that clinician is providing a service to care for the people of the state, or by their organization because that clinician incurred the risk of their mental health condition by serving patients within that organization. And ideally, there is a glide path back to treatment of patients once that impairment is resolved. So when we're talking about ideal PHP care, that's what we're talking about. Now, clinician and physician health programs are often not funded or are underfunded. They are often not supported by the state or by the organizations who are referring clinicians. And so the clinicians may bear the costs of that treatment. And in some states, there is not a defined glide path back to return to care. So what I would say is that the Federation of State PHPs has an ideal practice standard that is supportive, that is financially supported, and that it, includes that glide path back. That is what we are advocating for, is that impaired physicians have this pathway as an alternative to discipline that is supportive, that offers them best practice care, because the needs for healthcare workers in care are often different than the needs of other people, and that is supported either by the state or by their organizations.
Mhm.
We hear a lot of the negative and positive stories that individuals have had. And I think that, part of this is that healthcare workers, and particularly physicians, are a fiercely independent group who also carry a lot of internal and external stigma about mental health care. So beyond the institutional stigma about care, we don't think we need it and we don't want it
Mhm.
until we do. And so when someone is considered to be impaired, or there's concern about being impaired, there is an internal stigma that needs to be overcome about what does it mean to me as a caregiver who needs care. There's an external stigma, a concern about how others are going to think about me. And then, not all of the care that is being delivered to physicians follows that ideal model that we are advocating for. So I'm not surprised that you've heard mixed messages. PHPs can be life-saving, and they are certainly better, even in their non-ideal form, than what existed before.
Okay. Well, thank you for that really important explanation. And doctors have to know about everything you're saying and that you're out there fighting for them. And you had mentioned, that some of this is, of course, a global problem. And I do talk to doctors around the world. Do you connect with physicians around the world? Like, is there anyone on the Dr. Lorna Breen Heroes Foundation and other areas of the world? Corey?
Corey?
Yeah, I didn't realize that was for me, and I had to unmute for a second. We this time last year we were over speaking at the World Health Organization about these issues. We hear about there's a lot of similarities between what is driving burnout for physicians in the United States versus other places. The one thing that I would say that is very different in the United States is the experience with the electronic medical record and how that contributes to burnout. When you hear about physicians in other countries that are not using the medical record to document payment,
Right.
their experience with the electronic health record is like they're like the old days of writing, written charts, and they are just simply documenting the care for purposes of care continuity and treatment. The United States has got something a little bit different there. And so I think that is one of the big things that we focus on, frankly, through our program, Caring for Caregivers, is trying to make sure that physicians and frankly the organizations that are providing the day-to-day operational environment where they're working really can get at the root cause of a lot of the burnout, and particularly around those administrative and bureaucratic tasks that no one went to medical school to do, and certainly have really been thrust on the shoulders of physicians now heavily in the last 10 to 15 years, more so than in prior. So that is, I think, a big differentiator. But yes, the short answer is yes, we are hearing from physicians and certainly providing solutions that are applicable to physicians in other countries.
Fantastic, because that's one of the things that I want to be doing is finding even around the world like what is working, right? So everyone can support each other. I love that. And Stefanie, is there anything else you would like to share about any of the initiatives or your work with the Dr. Lorna Breen Heroes Foundation, or messages to doctors? You're muted.
I'll throw $1 in the mute jar, Kim, and
Yeah.
maybe podcast. Sorry about that.
No worries.
Um, we work in three ways, and the first way is through advocacy at the federal and state level. Um, the second way is really through accelerating solutions and recognizing those best practice solutions and helping to implement them through campaigns like the All In for Mental Health, and also the Licensing and Credentialing Champions Challenge program, and All In Caring for Caregivers, which is our state coalition. The third way that we act is through collaboration and coalition. And Corey talked about All In Wellbeing First for Healthcare, which is those 30 large or healthcare organizations that come together. But we also have a vital ambassador network and medical student coalition. And so for those listening, if you are looking for actionable ways to impact the mental health of healthcare workforce, if you are looking for a community of like-minded people, I encourage you to join Kim as an ambassador to the Dr. Lorna Breen Heroes Foundation. And we have quarterly activations of our ambassadors for advocacy, for fundraising, and to help spread the message of healthcare, mental health care for the healthcare workforce. So I encourage you to join as an ambassador. I'll make sure, Kim, that you have that link for the show notes. And I also just want to send a personal message, which is that we are selected in our training to be perfectionist and to be compulsive about that perfection. That is reinforced through our training and through our practice, and for a lot of good reasons, right? Because if you're writing orders in the ICU on my child, I want you double checking and triple checking those orders, and I want you thinking about her. That is one tool in a tool belt. And unfortunately, sometimes if you have a hammer and you're asked to change a light bulb, it's not the right tool. And we need to make sure that we're developing those other tools and thinking about those as well. So recognizing that there is a universe of systems change that needs to happen. I also want to encourage the health workers and particularly the physicians listening today to have self-compassion and to recognize that it's okay to not be perfect as a human being. That is, in fact, comes with the territory. And that we need to give ourselves the permission to get help and to be the one who is helped in our lifetime of helping others.
That was beautifully shared. And I know that Corey had shared a few links of how people can get in touch with him and the Lorna Breen Heroes Foundation. Was there any other links? You can both send me all the links that you want, but was there anything you wanted to mention here? Or do you feel like we've covered it?
I mean, I've got one more, which is that we are in the process of reauthorizing the Dr. Lorna Breen Healthcare Provider Protection Act, which is federal legislation that funds professional well-being programs in institutions around the country and helps to expand those statewide coalitions. And so another link that we will add to the show notes is to write your representative to support the reauthorization of the Dr. Lorna Breen Healthcare Provider Protection Act. If you just press the button and send a message, it makes a difference. If you write why it's important to you, along with that message, that really gets the attention of your representatives and brings to life the stories of healthcare workers, really tapping into that head, heart, move forward advocacy action that you can take. So I encourage you to become ambassador, write your representative, and to act in your own life to care for yourself and think about those all in for mental health actions as well.
Well, thank you. I love all of that. And I love that we've spoken to during the course of the career of a physician or other healthcare workers. Sometimes you need support. Sometimes you're in a position where you can support others. So I love that there's a place for all of this. And we could reach out to the Dr. Lorna Breen Heroes Foundation if you feel like you need support because you have the resources. And then if you want to offer support to your colleagues, there's a place for you as well. And I wanted to say I was happy to meet you both at the event in DC. So I have my pin. And Corey, just what would you like to say as we wind down? Any
I
last
mean,
words?
now you can tell why I say she's the best chief medical officer, right? No, I think everything that Steph said is spot on. We are just so honored to have you as our ambassador, Kim. Thank you for using your voice and entering this conversation and continuing to be in this arena with us. It's critical that we all lock our arms around the healthcare workers right now and really give them hope for a new day in healthcare. A new day is possible, it's achievable, but it'll be best achieved if we do it together. So grateful for you as an ambassador. So thankful for your audience to listen to us today, and look forward to hearing from your audience as well as our future conversations with you, Kim, about how we can continue to do this work together. So thank you so much for having both Steph and I today.
You're very welcome. I love our collaborations, and Corey and I have collaborated on a Kevin MD article speaking to this, which should be coming out anytime. And then we'll also record a podcast with Kevin when we have the opportunity to do that. So thank you again for being my guest. I really loved having you both, and I can't wait to publish this. And how I always end is I say, in closing, to move the needle in healthcare, we all need to raise our voices and we all need to care about each other. We already know that doctors need to care about patients. Patients need to care about doctors too. So stand up, doctors, and let's stand up for doctors.
Thank you.
Thanks, Kim.
You're welcome.